You've got a multiple mini interview coming up, whether you've applied for dentistry or dental hygiene and therapy. MMIs can be stressful and different universities have different approaches to them, but they all follow the same structure. You can have an online MMI or you can have an in-person MMI. Most of them are in person, and how it works is basically a huge circuit. So you have different stations, and it could be on the dental clinic, the dental floor, for example, in the hospital, and you have different stations set up. You're going to have a private interview with one interviewer, then you'll move over to the next interviewer. At each station, they can't hear what you said previously. So if you mess up one interview, just continue as normal, still go in with full confidence for the next one, because it is your average score that they consider. So you could really mess up one station, do really well in the others, and still score an offer. Now, first thing you want to do is you can go in there, shake their hand, take a seat, and you'll have a task or a scenario to read in front of you. You'll be given reading time, and that's usually 1 to 2 minutes to read the scenario, have a think about what you want to say or what they could possibly ask you and how you're going to answer it. There'll probably be a whistle that will blow or something to indicate that you can start speaking to the interviewer. Once the interviewer starts speaking to you, they might ask you questions about the scenario, or you might have to begin a task. So you can have manual dexterity tasks, you can have role plays, you can even have different sorts of scenarios like situational judgment scenarios. You can have questions like you've broken down on the motorway, there are 5 items you have in your car, you have to pick 3 that you're going to take with you, and one could be a traffic cone, one could be water, one could be a phone, one could be your passport, one could be your driving license. It can be so many different things, and they want you to pick 3 and then discuss that. So all they're looking for in these sorts of scenarios is your ability to problem solve, think on the spot, be able to communicate yourself clearly, effectively, because dentistry and dental hygiene and therapy, these are people careers. You're working with people day in, day out. You're dealing with challenging patients day in, day out. They're really looking for somebody who's empathetic, willing to learn, and really good communication skills. Now, with MMI scenarios, especially the ones in person, they don't have your personal statement. They read that ages ago, and you've ticked all of those boxes saying that, you know, you meet the academic requirements and all of that. They don't care about that now. They care about you as a person and your personality and what you're bringing to the table. So be really friendly, over enthusiastic, be positive. I know you're nervous. People forget to smile because they're so nervous. So what you want to do is just be yourself. And there are thousands and thousands of scenarios they could ask from. There is no way to prepare for everything, but practicing out loud and kind of preparing a structure can really help you to prepare. So I'm going to give you a few different ethical scenarios, situational judgment type scenarios, and that can help you to form some sort of structure. Now, during the 2 minutes of reading time, where you're sitting at the station and you're given the task or the scenario on a piece of paper, you're going to be reading that and planning what you're going to say and also planning how to answer it. Then when the whistle blows or they indicate it's time to speak to the interviewer, you can then start talking. They're going to ask you questions about that. Say one scenario could be based around conflict. Conflict is a common scenario, and you know what conflict happens in the dental team, it happens in the dental environment, at university. People disagree on things. There are differences of opinion. For situations like that, you can always listen, mediate, and resolve. That kind of summarizes any conflict scenario. Now, there's no right answer, there's no model answer. I promise you, on their mark scheme, there is no model answer that they're following word for word, because there are so many different ways of approaching a scenario. What you want to do is come up with a structure that kind of involves the NHS values of compassion, respecting others, everybody counts, and you want to drop in these keywords to your scenario. So if it's a very dental specific scenario, you're preparing for a group presentation and 2 individuals on the team have a really heated argument. How are you going to manage that? Now, I've got a specific video on that on my YouTube shorts, and you can check that out because it's a really good way to structure your answer. But generally what you're going to do in this situation is you're going to listen to everybody, mediate, resolve it. You're going to de-escalate the situation, take the individuals apart, hear them out individually. Why are they arguing? What's their opinion? What's their perspective? What's going on? And you're going to bring them together, mediate, remind them you all have a shared goal to work together for the presentation or to work together in patients' best interests, and then try and resolve the conflict, but reminding them that you're there to work as a team. This requires really good communication, really good active listening skills. I would need to be very calm to manage 2 people who are very heated, but sometimes all people need are time to just calm down and they just want to be listened to. Mentioning these things kind of shows the different angles and different perspectives. This is all they care about, your thought process, your ability to reason. For any scenario, here is the structure you can follow. The first thing, summarize the scenario back to the interviewer. There'll be so many times I'll do this during mocks. someone will summarize it back and I'll realize that they've misunderstood the scenario. That gives me an opportunity to clarify and say, by the way, this is actually what the scenario is saying. Firstly, summarize back. So for that team conflict scenario, I would say, so I understand in this situation was part of a conflict scenario because two individuals are having a heated argument and we're working together for a group presentation. In this situation, it can be really difficult to manage. What I would do is consider the NHS values of compassion, respecting others. We're here to work as a team, and I try and implement that in my management. Firstly, I would take the two individuals apart and then you'd go on to explain it. By mentioning the theme of conflict, mentioning the NHS values straight off the bat, it means you're ticking those boxes. It just means you won't forget it at the end, or you won't get cut off before you can mention the NHS values. Say it from the beginning, get that out the way, and then go into your management. Usually, if it is a dental specific scenario, some universities love dental specific ones. For example, somebody's taken the patient notes home, somebody's breached confidentiality, or you need to raise concerns about somebody. Usually it's based around things like that, where somebody's made a mistake, someone's done something wrong. You have to sort of manage it. What do you do in a situation where somebody has managed to get a hold of the final exam paper? They know all the questions that are going to be asked and the answers. This is providing them with an unfair advantage, and they just want to see how you're going to talk through it, what your steps are in managing this. This is a really difficult scenario because firstly, I'll be considering all the different factors. How did they get a hold of this? Did someone give it to them? One person has managed to get the exam paper. There is a chance that other people have also managed to get this too. In this situation, I'll be thinking about all these different things, and the biggest thing that stands out to me is academic integrity. Be honest, accountable, make sure we're actually competent to pass our exams. In this case, somebody is essentially cheating. In the long run, this can cause issues further down the line if they're passing their exams with insufficient knowledge. I would speak to the individual directly. I'd be very non-judgmental and ask them some questions to try and understand where they got a hold of this. If other people have got a hold of the exam paper as well, I would possibly speak to them. I would really encourage them to hand this paper into a supervisor or a lecturer. Make somebody aware that you have this paper in order for them to be able to change the exam in time. Always give them an opportunity to correct their mistake, hand it in themselves. Most of the time that situation is dealt with. Nobody is able to cheat then. They make sure that student has owned up. Just politely reminding them what they've done is wrong and why it's wrong to have the exam paper can be really, really helpful. Then the interviewer might probe you. Okay, what do you do in a situation where they don't hand it in? That's them challenging you now for you to get those extra points. But in a situation where somebody hasn't owned up, then it's a bigger issue. They're not upholding academic integrity, they're not being honest, and they're not owning up. As future dental professionals, you have to make sure you act professional, act with integrity. It's as simple as that. Now, there's no model answer. Whatever I just gave to you, it's just one way of managing that scenario. The main thing is follow a step-by-step approach. You wouldn't jump the gun and speak to the GDC. You wouldn't speak to the head of the year to report this. Take it step by step. Speak to a personal tutor, speak to somebody slightly higher up. If there's no resolution, speak to somebody even higher up. So that's a really common scenario, is somebody making a mistake, somebody doing something wrong, taking the exam paper. Something like that is really common in medical and dental scenarios, and it can be in so many different ways. There's probably 1,000 scenarios you can come up with somebody making a mistake or doing something wrong. I don't want you to memorize any sort of model answer, but use this as a guide to help you structure your answer. Always think about what skills are needed. You could always summarize at the end and say, to manage this, I'd need to have really good communication and listening skills. I have to be very compassionate to my teammates, here to work together, and I want to support them. I hope they'd encourage me to own up if I made a mistake as well. So things like that just adds a little bit of insight and shows a bit of your character. They don't want you to just jump to the management straight away. They don't want you to just jump and say, okay, I'll report it. And that's that. And you'll be surprised, people do say that. People will just say, okay, in this situation it's wrong, so I would then report it to someone and make them aware they have the paper. Now, that's not a comprehensive answer. You just want to talk about all different angles. Here's another scenario. What would you do in a situation where you're working with a trainee dental nurse and you see that she's not disinfecting the materials as per the protocol? Say, for example, you've taken a mold of somebody's teeth and they haven't disinfected it before sending it off to the lab. That's a key step that they have to do before sending it off. What would you do in this situation? And this is the exact same scenario. Like somebody's made a mistake and they might not be aware of it. So it's being polite, being very empathetic, taking them aside, making them aware of the issue that you've noticed and encouraging them to correct it. So make sure that they take the item back and disinfect it. It could be as simple as that. But you want to give all different angles. Why has the trainee dental nurse done this? Does she understand what's wrong about it? Is there further training needed? Has there been a miscommunication during her training? Maybe they had a lecture on this and she missed it. It could be so many different factors involved and they just want to see you talking through it. Now, another scenario could be a graph or article-based station, and they want you to read through it in those 2 minutes and explain it back to the interviewer. With a graph or article, it can be really challenging to go through when you have only 2 minutes to look through it. When you look at the graph, look for any key trends. So if there's generally a rise in something, if there's 2 lines, one thing is rising, another one is decreasing. So if there's some sort of correlation between the 2 lines, look for that. Any sort of trends, any anomalies, anything unusual about the graph. What is it showing? What's the title? You're explaining it back in a way that's clear and easy to understand, as if that person has never seen the graph before. Start with the bigger picture, then work your way inward. So any trends, usually there is a trend in the graph. If it's an article of some sort, don't jump into what your background knowledge is in that topic. Always explain the article really simply first to somebody as if they've never read the article before. Another scenario could be like a manual dexterity type of scenario, and that could be anything from making some sort of origami. It could be picking up beads with tweezers. Really hard to prepare for in advance, and a lot of these MMIs kind of want to see just how you perform under pressure. They want it to be really random scenarios. They sometimes want it to be really non-dentally related, even general medical, general healthcare questions, or really random ones like you're in the Arctic and you're on an expedition and you've been lost from the group. You have about 10 items in your backpack, but it's too heavy for you to carry everything, so you need to get rid of 5 of them. Which ones are you going to get rid of, and why are you getting rid of them? These are the 5 that I would pick. For each one, I'm going to go through why I've picked this one and why I haven't picked the other ones. So for example, they had like a light flare or something that you could use to call for help. That's something I would take because I see how this would be useful in the dark. If I see somebody's around and I need to grab their attention, I could use this. I wouldn't choose this item because of X, Y, Z. It's just showing all different angles, your ability to problem solve, talk out loud. They just want to hear more about you, what your thoughts are, how you think. Are you thinking outside the box? What are the other factors that you're considering? They just want to assess communication. I think every single station assesses communication in some way. Then there will be some general stations. The general stations are ones you can really ace with good preparation. That's going to be why this university, there might be a separate station on tell me about your work experience, or tell me about why hygiene therapy. Tell me about a time that you had to problem solve during a really challenging situation. These are just common interview questions that can come up in any interview. Anything which is skill-based, you can use the STAR method. STAR method is situation, task, action, result, reflection. I've spoken about the STAR method in another video, but I just really want you to focus on scenarios. For scenarios, summarize it back. Really think of a structure. Think about the GDC standards that might be coming into play. What theme are they asking you about? Is this a consent? Is this confidentiality? What are the factors that come into play? Talk through your management. And whilst you're doing your management, always think about the NHS values. But that is pretty much the most common scenarios to expect in your dentistry or dental hygiene and therapy multiple mini interview. There are so many different scenarios. The ones I've mentioned today, I don't want you to memorize the answers for any of the ones I've spoken about today because there is no model answer, but it's just to give you guidance on how you can structure it and approach different scenarios. If you need more resources, everything is down below. There's some really useful information in there that is going to make you stand out. You want to be an above average student, and a lot of it is communication. So show your thinking process, share your values. There are so many different scenarios you can practice. I've got some extra ones in the guide. Everything will be linked below.